Type 2 diabetes is when your body does not use insulin properly. This causes hyperglycemia, or high blood glucose levels. When glucose remains in the blood rather than going into your cells become starved, and over time your heart, eyes, kidneys, or nerves may be damaged without proper treatment. In response to higher blood glucose levels, beta cells, which are insulin-producing cells in the pancreas, make larger amounts of insulin, but over time the beta cells become less able to respond to blood sugar changes effectively. Type 2 is the most common type of diabetes, and some groups have a higher risk for developing it than others, and is typically a combination of lifestyle choice and genetics. Environmental factors such as poor diet and exercise are the culprits 74% of the time, while genetic mutations are the driving factor 26% of the time. Over 150 DNA mutations have been discovered. However, 36 possible gene mutations are the driving factors towards developing diabetes, and thus will be used for the SNP-CHIP test. Two of the biggest SNPs to test for, RS4402960 and RS132-66634. RS4402960 is a SNP in the gene IGF2BP2, which encodes for a protein that regulates human growth and glucose metabolism. If glucose metabolism is working incorrectly, this will lead to improperly increased levels of glucose, which can cause diabetes. The other SNP is RS132-66634, which is in the zinc transporter protein membrane 8-SLC30A8 gene. Alleles of these genes are associated with reduced insulin secretion, which in turn leads to higher glucose levels. For the average American, there is an 11% chance of developing diabetes. The lifetime risk of developing the disease increases to 40 in offspring when one of the parents with type 2 diabetes, and almost 70% if both parents have diabetes. RS4402960 genotype of GG has a normal risk for type 2. GT or TT increased risk by over 20%. RS132-66634 genotype TT has a normal risk for type 2, while CC increased risk by 24% and CT increased risk by 14%. While your genome might reveal a predisposition to diabetes, there's almost always a lot of uncertainty about your medical future and how much your DNA will drive your health, especially since environment affects diabetes development 74% of the time. However, the 26% that affects genetics is definitely reason to test, especially if you have high risk factors. These tests can place emotional stress on those who test at risk for diabetes and their families, so please consider this before receiving this test.